What techniques would you use to calm an upset patient?
Calming an upset patient requires a combination of empathy, effective communication, and practical interventions. First, I would ensure to approach the patient with a calm and composed demeanor, as maintaining a peaceful presence can significantly influence their state of mind. I would start by actively listening to their concerns without interrupting and acknowledging their feelings to make them feel heard and understood. This empathetic approach often helps in de-escalating heightened emotions. Next, I would employ techniques such as speaking in a soft, reassuring voice, making eye contact, and using appropriate body language to convey compassion and attentiveness. It's crucial to validate the patient's feelings by expressing understanding and concern. Phrases like, "I can see that you're really upset, and I want to help," can go a long way in building trust and reducing anxiety. Additionally, providing clear and concise information about their care or the situation they are concerned about can help alleviate fears and confusion. I would explain the next steps in their treatment plan or clarify any misunderstandings they might have. Ensuring they know what to expect can significantly reduce their anxiety. In cases where the patient is highly agitated, techniques such as guided breathing exercises or distraction through conversation about their interests can be beneficial. If appropriate, offering a quiet and private space for them to express their feelings or providing comfort items like a warm blanket can also help. Ultimately, the goal is to create a supportive environment where the patient feels safe and understood, which can significantly mitigate their distress and promote a sense of calmness.
How would you treat a patient with symptoms of seasonal allergies?
Treating a patient with symptoms of seasonal allergies involves a comprehensive approach that includes assessing the severity of symptoms, identifying triggers, and providing both immediate relief and long-term management strategies. First, I would conduct a thorough assessment to understand the patient's specific symptoms, such as sneezing, runny or stuffy nose, itchy eyes, and throat irritation. I would also ask about the duration and severity of their symptoms, any known triggers, and their medical history to rule out other potential causes. For immediate relief, I would recommend over-the-counter antihistamines, which can help reduce sneezing, itching, and runny nose. If the patient experiences nasal congestion, a decongestant may also be advised, but I would caution them about the potential side effects and the importance of not using these medications for extended periods. Nasal corticosteroid sprays can be highly effective in reducing inflammation and controlling more severe symptoms. For patients with itchy, watery eyes, antihistamine eye drops can provide quick relief. In addition to medication, I would educate the patient on non-pharmacological measures to manage their allergies. This includes advising them to keep windows closed during high pollen days, using air purifiers with HEPA filters to reduce indoor allergens, and washing their clothes and showering after spending time outdoors to remove pollen from their skin and hair. I would also suggest using saline nasal rinses to clear nasal passages of allergens. For patients with persistent or severe allergies, I might discuss the option of allergy testing to identify specific allergens. Based on the results, allergen immunotherapy, which involves regular injections or sublingual tablets to gradually desensitize the patient to allergens, could be considered as a long-term treatment strategy. Throughout the treatment process, I would emphasize the importance of regular follow-up visits to monitor the effectiveness of the treatment plan and make any necessary adjustments. By combining medication, lifestyle modifications, and possibly allergen immunotherapy, we can effectively manage the symptoms of seasonal allergies and improve the patient's quality of life.
How to handle being short-staffed at work?
Handling a short-staffed situation at work requires strategic planning, effective communication, and adaptability to ensure patient care remains uncompromised and team morale stays high. The first step is to assess the immediate priorities and redistribute tasks accordingly. This involves identifying the most critical tasks that must be accomplished and reallocating responsibilities among the available staff. Open communication is essential in this phase, ensuring everyone understands their adjusted roles and responsibilities. Next, I would implement time management techniques to maximize efficiency. This could include clustering similar tasks together, delegating non-clinical duties to support staff, and utilizing time-saving tools or technology where possible. Streamlining workflows and eliminating non-essential activities can help reduce the burden on the team. It's also important to foster a supportive and collaborative environment. Encouraging teamwork and open communication can help alleviate stress and ensure everyone feels supported. Regular check-ins with the team to discuss challenges and progress can provide a platform for problem-solving and mutual support. Recognizing and appreciating the hard work and dedication of the team can boost morale and motivation during challenging times. Seeking external support can also be beneficial. This might involve reaching out to temporary staffing agencies to fill gaps, arranging for float staff from other departments, or discussing the situation with management to explore options for additional resources or overtime compensation for the current staff. Self-care and stress management are crucial for maintaining the well-being of the team. Encouraging regular breaks, promoting a healthy work-life balance, and providing access to mental health resources can help staff cope with the increased workload. Finally, documenting the impact of being short-staffed and any steps taken to mitigate the situation is important for future planning. This information can be used to advocate for additional permanent staffing or improved processes to prevent similar situations in the future. By prioritizing tasks, enhancing efficiency, fostering teamwork, seeking additional support, and promoting self-care, the challenges of being short-staffed can be managed effectively, ensuring both patient care and staff well-being are maintained.
If a patient is found to be severely ill, what would you do?
If a patient is found to be severely ill, the immediate priority is to ensure their safety and stabilize their condition. First, I would quickly assess the patient's vital signs, such as heart rate, blood pressure, respiratory rate, and oxygen saturation, to determine the severity of their condition. Based on this assessment, I would initiate the appropriate emergency protocols. If the patient's condition is life-threatening, I would activate the emergency response team by calling for immediate assistance from doctors, nurses, and any available medical personnel. This might involve using a hospital's emergency code system, e.g., Code Blue for cardiac arrest. Simultaneously, I would begin providing life-saving interventions within my scope of practice, such as administering oxygen, starting CPR if necessary, or using an automated external defibrillator, AED, if the patient is in cardiac arrest. Next, I would ensure that the patient has a secure airway, breathing, and circulation, the ABCs of emergency care. If the patient requires advanced interventions, such as intubation or intravenous medications, I would assist the physician or advanced practice provider in these procedures. Monitoring the patient's vital signs continuously during this time is crucial to gauge the effectiveness of the interventions and make necessary adjustments. Communication is vital in such situations. I would keep the patient's family informed about their condition and the steps being taken to stabilize them, ensuring to do so with empathy and clarity. Additionally, I would document all actions taken and observations made during the emergency response, which is critical for ongoing patient care and legal records. After the initial stabilization, I would assist in transferring the patient to a higher level of care if needed, such as an intensive care unit, ICU. Ensuring a smooth handover to the receiving team by providing a comprehensive report of the patient's condition, treatments administered, and response to those treatments is essential for continuity of care. Throughout this process, I would maintain a calm and focused demeanor to provide the best possible care to the patient and to support my colleagues in managing the situation effectively.
How do you break bad news?
Breaking bad news to a patient or their family is a delicate and compassionate process that requires sensitivity, clear communication, and emotional support. I would follow a structured approach to ensure the message is delivered in the most supportive way possible. First, I would prepare for the conversation by reviewing the patient's medical information to ensure I fully understand the situation and the prognosis. It's important to find a private, quiet, and comfortable setting where the discussion can take place without interruptions. If possible, I would also ensure that a support person is present, such as a family member or a close friend of the patient. When starting the conversation, I would begin by introducing myself and establishing rapport. I would then ask the patient or their family what they already know about the situation. This helps gauge their level of understanding and prepare them for the information to come. Next, I would deliver the news in a clear, straightforward manner, using simple and direct language. I would avoid medical jargon to ensure they fully understand the information. For example, instead of saying, "The prognosis is poor," I might say, "The treatment is not working as we hoped, and the illness is getting worse." Throughout the conversation, I would be empathetic and allow pauses for the patient or their family to process the information. I would also encourage them to express their emotions and ask questions, reassuring them that their feelings are valid and that it is okay to be upset or confused. I would then provide as much information as they need about the next steps, including treatment options, palliative care, or hospice care if appropriate. It's crucial to offer hope and support, focusing on what can be done to manage symptoms and improve quality of life. Finally, I would ensure that they have access to additional support, such as counseling services, social workers, or patient support groups. I would provide them with written information and be available for follow-up discussions to answer any further questions they might have. Breaking bad news is always challenging, but by approaching the conversation with empathy, honesty, and support, I can help patients and their families navigate this difficult time with dignity and understanding.
How do you assess a patient's pain?
To assess a patient's pain effectively, I would start by introducing myself and explaining the purpose of the pain assessment to build rapport and trust. After obtaining the patient's consent, I would employ a comprehensive approach using the PQRSTU method, which helps in systematically gathering detailed information about the pain. First, I would explore the provoking and palliating factors by asking questions such as, "What causes the pain?" and "What relieves it?" Understanding what makes the pain better or worse can provide insights into the nature of the pain and potential triggers. Next, I would focus on the quality of the pain, asking the patient to describe it in their own words. I might ask, "Can you describe what your pain feels like? Is it sharp, dull, throbbing, or burning?" This helps in identifying the type of pain and potential underlying causes. Then, I would determine the region and radiation of the pain by asking, "Where is the pain located?" and "Does the pain spread to other areas?" Mapping the pain's location and any radiating patterns can assist in diagnosing the source of the pain. To assess the severity of the pain, I would use a standardized pain scale, such as a numerical rating scale, 0 to 10, where 0 indicates no pain and 10 represents the worst pain imaginable. I would ask, "On a scale of 0 to 10, how would you rate your pain right now?" This quantifies the pain and helps in monitoring changes over time. Understanding the timing of the pain is crucial, so I would inquire about the onset, duration, and frequency of the pain episodes. Questions like, "When did the pain start? Is it constant or does it come and go? And how long does the pain last?" provide a timeline of the pain experience. Finally, I would assess the impact of the pain on the patient's daily life by asking, "How does the pain affect your daily activities, sleep, and mood?" This holistic approach ensures that the patient's overall well-being is considered. Throughout the assessment, I would acknowledge the patient's discomfort and offer reassurance. Empathy and active listening are key components in making the patient feel supported and understood. After completing the assessment, I would document my findings accurately and communicate them to the relevant healthcare team. Based on the assessment, I would administer appropriate analgesia as prescribed and develop a pain management plan tailored to the patient's needs. Regular reassessments would be conducted to monitor pain levels and adjust management strategies as needed. Maintaining a patient-centered approach throughout ensures that the patient's comfort and well-being remain the primary focus, ultimately leading to more effective pain management and improved patient outcomes.
What would you do if a patient is non-compliant with medication?
When dealing with a patient who is non-compliant with their medication regimen, it's important to approach the situation with empathy, understanding, and a problem-solving mindset. My first step would be to have an open and non-judgmental conversation with the patient to understand the reasons behind their non-compliance. This could involve scheduling a private and comfortable setting where the patient feels safe to share their concerns. I would start the conversation by expressing genuine concern for their well-being and explaining the importance of adhering to their prescribed medication regimen. Then, I would ask open-ended questions to uncover any underlying issues. Common reasons for noncompliance might include side effects, financial constraints, lack of understanding of the medication's importance, or simply forgetting to take the medication. Once the underlying reasons are identified, I would work collaboratively with the patient to address these issues. For instance, if side effects are a problem, I would discuss alternative medications or adjustments to the dosage with their physician. If cost is an issue, I would explore generic alternatives, assistance programs, or pharmacy discounts. For patients who have trouble remembering to take their medication, I might suggest practical solutions like setting reminders on their phones, using a pill organizer, or aligning medication schedules with daily routines. Education is also a key component in improving compliance. I would ensure the patient understands how the medication works, its benefits, and the potential risks of not taking it as prescribed. Providing written materials or visual aids can reinforce this information. In some cases, involving the patient's family or caregivers can provide additional support. They can help remind the patient to take their medication and monitor for any issues that arise. Finally, I would establish a follow-up plan to monitor the patient's progress and adherence. Regular check-ins, whether in person, by phone, or through telehealth, can help reinforce the importance of compliance and provide ongoing support and adjustments as needed. By addressing the root causes of noncompliance and providing tailored support, I can help patients adhere to their medication regimens, ultimately improving their health outcomes.